COVID-19 has brought Yemen's health system to a complete collapse. That's according to the medical charity Doctors Without Borders. The real numbers of dead there are almost impossible to determine, with low levels of testing and some authorities suppressing the true death toll. Yemen was already facing the world's worst humanitarian crisis after a conflict which started more than 5 years ago, with Houthi rebels backed by Iran fighting Yemen's government, which is backed by a coalition led by Saudi Arabia and supported by the US and the UK. Our chief international correspondent Lyse Doucet has this report.
In a nation scarred by war, a new landscape of loss, the dead taking more space from the living as a graveyard grows in southern Yemen. No one knows how many are dying of COVID-19, but with every day, more Yemenis know this pain of life and death in the time of the virus. And doctors see the worst. Dr. Zoa Al-Sadi works in an intensive care unit in the southern city of Aden. She's just finished her night shift.
The health situation in Aden is very bad. The people die in hospital. The people die in ambulance while they waiting for empty bed. The people die in home. We can't do anything for them. They're just suffering and die.
There's little dignity in this death and great disquiet. Here in northern Yemen, the Houthi authorities try to hide how many die from the virus. So some bury the dead in the dead of night, men dressed in white, fearing for their own lives. But someone at this graveside sent us these images. So his friend Yusri isn't forgotten. A young dentist said to be killed by COVID-19. His father died 2 days before him. His wife fell ill.
We need a help. The people in Yemen need help.
We've heard so many stories. A doctor in northern Yemen tells me he stopped going to work at the health ministry. It's too dangerous, he says.
The Houthi authorities say that the situation is under control now. Is that true?
No. Absolutely not under control. From every family, from very few, there is 1 or 2 die from corona. Everyone is afraid.
This deadly virus is moving undetected across a country twisted in two by a long war and all the old pestilence, including cholera. Yemen's health system has all but collapsed, testing for COVID-19 among the lowest in the world. Across this country, doctors tell us their beds are full. They don't know where to put the sick and dying. And there's so little specialist care. Doctors like Hyrul Musa doing whatever they can.
A bit of despair that we can't do more for the patients here. And I guess, we try our hardest with what we have, and for each day the sun still rises, so we do what we can, but it's hard. It's really hard. The disease itself is ravaging through lives.
Yemenis have so few defences. And last week, a UN appeal for life-saving funds fell far short. In a world of COVID-19, it's feared Yemen could suffer the greatest catastrophe of all. Lyse Doucet, BBC News.